Hey guys, today I'm going to be doing a video on something called Postural Orthostatic Tachycardia Syndrome, or POTS. So the outline of this video is really going to be explaining what POTS is, the symptoms, how it's diagnosed, how it's treated, what some of the causes are. So Postural Orthostatic Tachycardia Syndrome, or POTS, basically means that you have a fast heart rate, which is tachycardia, when you stand up. So that's the postural and orthostatic part of it. POTS is a form of dysautonomia. Dysautonomia is another word for dysfunction of the autonomic nervous system. And what the autonomic nervous system does is it controls all of the involuntary functions of our body, such as heart rate, blood pressure, digestion, sweating, changing the size of our pupils, things of that nature. The autonomic nervous system is broken down into two parts. The first part is the sympathetic nervous system, which is also known as the fight or flight response. And then the other side of it is the parasympathetic nervous system, which is the rest and digest part. In dysautonomia, the sympathetic nervous system is in way overdrive, while the parasympathetic nervous system is barely working at all. So POTS is actually a lot more common than we're aware of. It is estimated that about 1 in 100 people actually have POTS, and it's actually very underdiagnosed. And the reason that is because a lot of doctors, NPs, and PAs are very unfamiliar with POTS and the symptoms that it causes. So when people come in with the symptoms, they're automatically thinking orthostatic hypotension, anemia, heart valve issues, heart failure, etc., everything except for POTS. And I can attest to that because we really didn't talk about POTS that much in my PA program, and I'm sure a lot of other med school programs and PA programs and NP programs out there haven't really talked about it much either. And that's because the disease was first coined in the 90s, so it's really a relatively new diagnosis, and this is why awareness is so important, and this is why I'm making this video. The diagnostic criteria for POTS is when you go from a laying position to a standing position, your heart rate has to increase within 10 minutes, 30 beats per minute from your resting heart rate when you were laying down. For children, it has to go at least 40 beats per minute, and that's because they have higher resting heart rates and a more responsive heart. So in order to test this, you have to have something called a tilt table test. And that is when you lay flat on a table, and they usually have you sit there for about 30 minutes, and then eventually they'll tilt you up to about like a 70-degree angle, and they will monitor your vital signs, including your heart rate, your blood pressure, and your electrocardiogram, which is the squiggly lines that measures your heart rhythm. And from there, they will see what your vitals are doing. If you're having any symptoms, try to figure out what your diagnosis is. Something that seems to be a misconception is that when people have tilt table tests, they like to say, oh, my blood pressure dropped to 80/40, I have POTS. And that actually is not a true statement, because according to the diagnostic criteria for POTS is that you have to have the increase in the heart rate in absence of a drop in blood pressure. And that is because if you have a drop in blood pressure first and then your heart rate increases, that's because your heart is responding appropriately to your drop in blood pressure. That is known as orthostatic hypotension. That is a whole different thing that I'm not really going to talk too much about, but that is typically something that happens when you're really dehydrated and you stand up and you black out for a minute. It happens. It's very, very common. So a lot of people actually, as soon as they go up, they'll get a really high heart rate and their blood pressure either stays the same or it increases. For me, my heart rate went up to about 190 and my blood pressure, if I'm remembering correctly, went up a little bit. And I was still symptomatic, so my blood pressure wasn't my problem. Needless to say, though, your blood pressure can eventually decrease. And that's because if your heart rate stays really high, the amount of blood that it can pump out that quickly starts to slowly drop. So that's why some people do have low blood pressure after a while. And that does happen to me, for example, in the shower when it's, really warm. And after a while, my blood pressure will start to go down. But the high heart rate happens in absence of the blood pressure change. And that is POTS. A positive tilt table test does not mean that you automatically have POTS. What a positive tilt table test means that your symptoms were recreated during the tilt table test. There are many things that can cause a positive tilt table test. As I was referring to orthostatic hypotension, that would be a positive tilt table test. In addition, something called vasovagal syncope or neurocardiogenic syncope, that can cause a positive tilt table test. And there are many other things, such as arrhythmias can even cause them, and the list goes on. So there are a lot of causes of POTS. Most of the ones that I have come across include connective tissue disorders such as Ehlers-Danlos syndrome, autoimmune conditions such as Sjogren's syndrome, lupus, rheumatoid arthritis, and other things that are widely accepted as causes are viral. So like after you have a virus, you can develop POTS. Deconditioning from being in the hospital for a couple weeks, just laying down for a long period of time, your body could become used to the laying down. And once you start getting up, your body isn't really used to that anymore. So according to Dysautonomia International, about 50% of people with POTS have something called small fiber neuropathy. So if you have neuropathy and your nerves aren't working properly, the nerves aren't able to tell the muscles in your blood vessels to constrict. They stay kind of open, and that results in blood pooling, and thus it results in POTS. So connective tissue disorders such as Ehlers-Danlos syndrome, there's a couple of theories as to why POTS is so common in these conditions. So one of them has to do with the fact that in connective tissue disorders, you have faulty collagen, and collagen is very abundant in the body. And one thing that collagen is used for is the baroreceptors in your carotid artery. The baroreceptors are made of collagen, and when you have really loose and stretchy collagen, your baroreceptors, which sense pressures, and that's how your body knows what your blood pressure is, it doesn't really know exactly what your blood pressure is at all times, especially when you stand up. So it thinks that your blood pressure is really low because that baroreceptor is really loose and stretchy. So the sympathetic nervous system goes into overdrive, and your heart rate and maybe even your blood pressure start to go up. Another theory is that in connective tissue disorders, the blood vessels, and including the veins and the arteries, are really loose and stretchy, just like the baroreceptors. So that theory says that when you go from a laying position to a standing position, a lot of your blood pools in your legs. If you have a lot of blood volume in your legs, that means your heart has to work a lot harder to get the blood up to your head. In reality, it's probably a combination of both of them. I don't think it's one or the other. I definitely think it is a combination of both. In autoimmune diseases, the theory is that there are autoantibodies. So basically, autoantibodies are antibodies that attach to parts of your own body, and the antibodies will mark that tissue that it connects to for your immune system to attack it. So an antibody is typically used to fight, viral infections, bacterial infections, etc. But when you have an autoantibody, auto means self, you have an antibody to yourself. So that is what causes autoimmune diseases. So the autoimmune theory is that in things like lupus and RA and Sjogren's syndrome, you start to develop antibodies to the receptors on your blood vessels that control constriction. So your blood vessels are unable to constrict when you stand up. So again, the blood pools because there's no vasoconstriction. because the receptors for the, it's called the alpha receptors, which constrict. Those are the receptors that are being destroyed or messed with. There are many more causes, so I will go ahead and list them because I'm not going to read them because there's a lot. Those are all listed from the Dysautonomia International website. Another huge point I want to make is that POTS is not caused by anxiety. Whenever I stand up, my heart rate doesn't increase because I'm anxious. My heart rate increases for all the reasons I've already talked about, because I have a connective tissue disorder. So please don't tell me that, oh, it's just anxiety. Oh, you're just nervous about standing up. That is not the case. So the symptoms of POTS can vary widely. I'm going to separate them from the symptoms that people get upon standing and then the symptoms that people get that are just in general all the time or whenever. So of course, the first symptom that happens when standing are palpitations. So feeling like your heart is racing or feeling like you have a flutter in your chest. Another huge hallmark symptom for POTS is dizziness or lightheadedness when you're standing, along with tunnel vision or like vision changes or feeling like your vision is kind of going into like a tunnel or completely blacking out. Another symptom that people quite often get when they stand is nausea or even just feeling like crap. Like really no other way to describe it as like other than I just feel like crap and I want to sit down. I also quite often get short of breath just from my heart racing so quickly and my body's not really getting enough blood flow as it should be. So this disease was nicknamed the fainting disease, and I think that's a huge misnomer. I think, don't quote me on this, it's about like half of people with POTS have passed out, or maybe a little bit more than that, but not a significant amount. I have never completely passed out from POTS. I've come very close a number of times, but I've never completely passed out. So, but needless to say, some people do pass out, or it's called syncope. But a symptom I frequently get is called pre-syncope, and that is the same thing as the tunnel vision or feeling like you're about to pass out. Another symptom that people quite often get is blue or purple discoloration on the legs, and that is simply from the blood pooling, as you could imagine. They also often get a rash, and it's called LIVEDO reticularis, and I will try to insert a picture here. This picture won't be of me because I have it a little bit, but it's not super obvious on pictures. And that's also due to the blood pooling in your legs and poor circulation. Another thing that happens is tremors or just getting really shaky, and that is just due to all of the hormones that are being released when you're standing up. Your sympathetic nervous system is releasing all those hormones, and you just get really shaky. Like, think about when you're nervous. What happens when you're nervous? Your heart races and you're really shaky, might even get a little bit nauseous, etc. So all of those symptoms that I just talked about typically resolve as soon as the patient lays down. But in general, there are other symptoms that people with POTS can have. And those are things like brain fog, and that's kind of just feeling cloudy, like you can't really think straight or you can't concentrate very well. You'll be talking in the middle of a sentence and you'll not be able to find the word that you're looking for, or you just forget simple things throughout the day. I saw this meme one time about brain fog. Brain frog? Okay, Miranda. There we go. Brain fog. And it was this girl that was eating yogurt, and she had a spoon and then yogurt, and she opened the trash can, threw the spoon away. And I was like, yeah, that's a pretty accurate representation. I mean, that happens to people in general, but with people with POTS, it happens pretty often. Anyways, fatigue is a very common symptom, just feeling tired all the time. And it makes sense because if your nervous system, if your body is always in fight or flight mode, No wonder why you're going to be tired all the time. Could you imagine trying to run away from a bear constantly every day? Or at least your nervous system is thinking that you're running away from a bear all day, every day when you're standing. Makes sense, right? And then also a lot of people complain of digestion issues. And this has to do with the fact that when your sympathetic nervous system is in overdrive, your parasympathetic nervous system is way regulated down. And your parasympathetic nervous system is responsible for the rest and digest portion of your bodily functions. So when your parasympathetic nervous system gets down-regulated, your gut doesn't work as much as it should. So people with POTS and other forms of dysautonomia typically get decreased gut motility. So chronic constipation, gastroparesis, IBS, bloating, and etc. And that is the theory as to why this is happening. Additionally, a lot of people with POTS get migraines and a lot of other headaches, and that is most likely due to the decreased blood flow that you get when you're standing. And lastly, a lot of people experience exercise intolerance, and this is pretty self-explanatory. It is recommended that people with POTS swim or use the recumbent bike, or just do things sitting. So as for treatment of POTS, this varies person to person. Me personally, I'm on a beta blocker called metoprolol. I know a lot of other people are on propranolol, etc. There are a bunch of other beta blockers. They all end in OLOL. And I feel like this medication works the best for the people that don't have significant drops in blood pressure, as orthostatic hypotension or just hypotension is a side effect of beta blockers. So that's why beta blockers don't work for some people. The way beta blockers work is they block, depending on which beta blocker you're on, it can block beta 1 and beta 2. The one that I am on, it only blocks beta 1. So if you have asthma, you're not going to want to take one that is beta 1 and beta 2. And I'm not going to get really into that right now. But so it blocks the beta receptors, and the beta receptors are receptors for the sympathetic nervous system, and when they're stimulated, the heart rate and the contractility of your heart will increase. So beta blockers slow the heart down and decrease the contractility, so your heart doesn't have to work as hard. Another medication that a lot of people take is midodrine, and that is a medication that stimulates the alpha receptors that I was talking about earlier, and it stimulates the contraction of the blood vessels. So it causes higher blood pressure. So if you have issues with high blood pressure, you're probably not going to want to take this one, etc. So there's a bunch of different medications, and not everyone is going to work for every single person. Another medication is called ivabradine or Corlinor, and this unfortunately has not been approved for the use in POTS, so insurance doesn't cover it, and it can be pretty expensive. I don't know exactly how much, but that's what I've heard. So this one, it slows down the conduction rate at what's called the SA node, and that is where all of the conduction in your heart starts. So it's kind of similar to a beta blocker, but it works directly at the SA node, and it slows the conduction down there. In addition to the medications that I've already mentioned, dysautonomia mentioned quite a few other medications that are used for POTS. I'm just going to list them off. I'm not going to talk about them as much as I did the other ones. So they include fludrocortisone, clonidine, pyridostigmine, benzodiazepines, SSRIs and SNRIs, erythropoietin, and octreotide. I will put the link to the Dysautonomia International website below so you can look through it yourself for more information. Another treatment for POTS is lifestyle changes. So exercising more. My geneticist, when I got diagnosed with EDS, told me that I need to be doing cardio exercise for 30 minutes at least 5 days a week. And she recommended that I do recumbent bike or sitting bike or swimming or any kind of other sitting aerobic activity. And she told me that there's no good heart rate target for everyone because everyone is so different. But she told me to exercise to the point where I get a little bit sweaty. She worded it as a bead of sweat on your upper lip. And I typically don't sweat on my face all that much, so I'm a pretty good gauge as to where I am, and like I know what my good heart rate is, and it's not pushing me too hard. So you just have to kind of feel it out for yourself and see what a good intensity is for you. And that exercise regimen that she recommended to me actually was a study in an article, and I don't know the actual study or the article. I haven't found it, but it has been proven to increase the quality of life in patients with POTS. Secondly, wearing compression stockings can help a lot when you know that you're going to be standing quite a bit. Dysautonomia International also recommends about 2 to 3 liters of water per day to increase the blood volume to decrease the symptoms of POTS. Another thing you can do is avoid substances that you found trigger symptoms. So caffeine is a good example of that, and alcohol is a huge trigger for me. And then a high salt diet is something that everyone with POTS is pretty much on, which is funny because typically we think of salt as bad, but people with POTS need a lot of salt. Dysautonomia International says that increasing salt intake to 3 grams to 10 grams a day can improve symptoms. That's a lot. So it's hard to eat that much salt, but it's doable. Some people take salt tablets if they can't eat enough, especially if you have gastroparesis. Getting that much salt in your diet is going to be really hard. And also, so is increasing your water intake. Just drinking as much water as you possibly can. It can be hard, especially if you have gastroparesis. Like I was saying, it can be hard to drink that much water, and that is why a lot of people with POTS, they have gastroparesis. That's why they need central lines. I know a lot of people out there are wondering why people with POTS all of a sudden are getting central lines, and that's why. They can't drink enough water for them to keep enough blood volume in order to keep them from passing out. So there you go. I don't need it. I don't have gastroparesis, but there are people out there that do need that. So that is all I have about POTS today. I hope everything was clear and everything made sense. So let me know if you have any questions, and give the video a thumbs up if you enjoyed it, and subscribe to my channel if you want to see some more videos. Bye!